Hello people, in this video we want to understand dissociative or conversion disorder. So basically here what they're saying is that there is a loss of some function, okay, and it is not fully explained by any organic disease. You can't find actually anything wrong with these people, but there is something that is missing in their functioning, okay. So like there are so many things here. Just look at this. They can have some sensory loss, okay. They can have some motor loss, like function of limb or some gait disturbance, or they can have some aphonia, speech again that can become motor, right? Blindness. They can have seizures which is non-epileptic. So these are some things that you cannot find a cause. So the cause is unknown, but there can be some recent stress that caused it, or some adverse childhood experience like physical abuse, sexual abuse, etc. So did you get the cause, people? There can be an organic disease which precipitates the condition, but what we are trying to say is there is actually no disease, okay. Now there can be some conversion disorders like motor or sensory. This will be so motor, anesthesia, sensory, or even convulsions they have written here. Dissociative disorder, they are mentioning more about the memory, consciousness, identity kind of thing. So they can have some identity, means what? Multiple personality disorder. This is a dissociative identity. They can have amnesia, memory. Fugue. What is fugue? Fugu. How do you say this? This is more like some wandering they are saying. Wandering. Multiple personality, we told you. Trance, possession. This sounds like some movie. She's possessed. Ganser syndrome. This is seen in prison mates. So basically here they are saying that you ask some question, they will deliberately give, or they don't know. I don't know if it's deliberate, but if you ask the color of a red pen, they will say it is blue. They have some problem. Okay. So, so how will you treat all this? You'll have to do some behavioral therapy, psychotherapy, all those things you will write. So where were we? Here is it, psychotherapy. Then you can give behavioral therapy, cognitive behavioral therapy, or combine both. So some things they're saying you should stop the thoughts or stop its modifications, response prevention, don't respond. Systemic desensitization, modeling, some complicated psychiatry stuff here. How will you treat it medically? Benzodiazepine, standard treatment for us. SSRIs, fluoxetine, antipsychotics, buspirone. So basically, if you want to read more about this, guys, you will have to look at a psychiatry textbook. Here we are just telling you that there is something like this where you will not find the organic cause. Okay.